Hello, I'm Bob Oakley, one of the cardiologists working here at Citizens in Victoria. I'm here today to talk a little bit about women's heart disease and women's health. First order of business is to dispel a myth, do a little myth busting. And that myth is that women don't have much trouble with heart disease. Nothing could be further from the truth. Breast cancer gets, more of the press, and rightly so, and we'll even have better t-shirts. But the fact is, heart disease kills more women in this country than anything else, breast cancer included. Like all myths, this one has a little starting truth, and that is that premenopausal women do have a lower incidence of heart disease than men, all else being equivalent. After the menopause, there's a huge catch-up, so that by age 65, 1 in 3 women will have some form of heart disease in this country. The other part of that myth is that the heart disease is undercounted and underappreciated. Women have a higher chance of having their heart disease misdiagnosed or not diagnosed at all, and it goes uncounted. And if it's not counted, it's not in statistics, and that leads to the perception that they don't have as high a risk of heart disease as men. Undercounting comes in 2 forms. One, you don't think about it. If you don't suspect it, you won't evaluate for it. You'll miss it. The other is that women tend to have somewhat different symptoms than men for heart disease. The traditional chest pain associated with coronary disease may be absent in women who are having heart attacks, and in fact, twofold higher risk of having a heart attack without chest pain than men. And that can lead to a misdiagnosis, a delay in diagnosis, and increased risk. Women's coronary disease can be manifest in different ways, and not necessarily chest pain. It can be shortness of breath, nausea, sweating, or simply just weakness. And symptoms like that merit evaluation, and an in-depth evaluation. A simple EKG may not do it. We'll take further study like stress testing in order to diagnose it, identify it, and treat it. Actually, there is a form of heart disease that women have more risk of than men, and that is heart failure later in life. It's usually associated with older ladies with a history of high blood pressure that may not be well treated, and is manifest as shortness of breath and swelling in the ankles. And that's why it's important to identify and treat high blood pressure. We'll talk about that in a minute. But the number is 130 over 80, and that's a new number. It used to be 140 over 90, but now in order to adequately treat high blood pressure, the goal is 130 over 80 or lower with medication. Which brings up the second part of this, which is it's a lot easier to head off something than it is to treat something. Ounce of prevention is worth a pound of cure and then some. And if you don't know what the risk factors are, you don't know how to head it off. And the usual risk factors are family history, which you can't really do much about, but you can act on the information, which is to say that if your parents have trouble at a young age, that is 50 or 60 years old or younger, that's a heads up to look at the other risk factors. And those are high blood pressure, which we already talked about. The goal is 130 over 80. Treat it to that level. We have the tools. High cholesterol, we know the number. Get it checked, treat it. Diabetes, a little tougher because it requires good diet, exercise, weight control, watch the sugars. Then my favorite, which is cigarette smoking. Yeah, just don't. That's your quick tour of heart disease. I'm Bob Oakley at Citizens.